General practitioner. This is the doctor most people see first. A general practitioner, often called a GP or family doctor, handles a wide range of everyday health concerns. From colds and infections to managing chronic conditions like high blood pressure, they serve as the first point of contact in most healthcare systems around the world. If something falls outside their scope, they refer the patient to a specialist. In many countries, you cannot see a specialist without first going through a general practitioner. Their role is built on long-term relationships with patients, sometimes caring for the same family across generations. Internist. While the name might sound vague, an internist is a doctor who specializes in internal medicine, focusing on the diagnosis and treatment of diseases in adults. They deal with complex medical problems involving the heart, lungs, kidneys, liver, and nearly every other internal organ system. Some people confuse internists with general practitioners, but the key difference is that internists focus exclusively on adult patients and often handle more complicated cases. Many internists also go on to subspecialize, becoming cardiologists, gastroenterologists, or other types of specialists. Pediatrician. This is the doctor dedicated entirely to the health of infants, children, and adolescents, typically up to age 18. Pediatrics became recognized as its own distinct specialty in the mid-19th century, when physicians began to understand that children are not simply small adults. Their bodies respond differently to illness, medication, and treatment. Pediatricians monitor growth and development, administer vaccinations, and diagnose childhood diseases. They are trained to recognize conditions that are unique to younger patients, things that an adult-focused doctor may rarely encounter. Cardiologist. A cardiologist is a doctor who specializes in the heart and the cardiovascular system. They diagnose and treat conditions such as heart failure, arrhythmias, coronary artery disease, and congenital heart defects. Cardiology became one of the most critical medical specialties in the 20th century as heart disease rose to become the leading cause of death in much of the world. Some cardiologists focus on non-invasive treatments, using imaging and medication, while others, known as interventional cardiologists, perform procedures like inserting stents or opening blocked arteries using catheters. Dermatologist. This doctor focuses on the skin, hair, and nails. Dermatology covers everything from acne and eczema to serious conditions like melanoma, a potentially deadly form of skin cancer. The skin is the largest organ in the human body, and its health can sometimes reveal problems happening deeper inside. Dermatologists are trained to recognize thousands of different skin conditions, many of which look remarkably similar to the untrained eye. Some also specialize in cosmetic procedures, though the core of their training remains medical. Neurologist. A neurologist deals with disorders of the nervous system, which includes the brain, spinal cord, and peripheral nerves. Conditions like epilepsy, multiple sclerosis, Parkinson's disease, and stroke all fall under their domain. The nervous system is arguably the most complex system in the human body, and neurologists spend years learning to interpret its signals. They often rely on detailed neurological exams and advanced imaging to reach a diagnosis. It is worth noting that neurologists typically do not perform surgery. When surgery is needed on the brain or spine, that responsibility falls to a different specialist entirely. Neurosurgeon. This is the doctor who operates on the brain, spinal cord, and nerves. Neurosurgery is widely considered one of the most demanding specialties in medicine, both in the length of training required and the precision the work demands. A single millimeter can make the difference between a successful outcome and a devastating one. Neurosurgeons treat brain tumors, spinal injuries, aneurysms, and certain types of chronic pain. Their training can take up to 15 years after medical school in some countries, making it one of the longest paths to becoming a fully qualified specialist. Orthopedic surgeon. This doctor specializes in the musculoskeletal system, meaning the bones, joints, muscles, tendons, and ligaments. If someone breaks a bone, tears a ligament, or needs a hip replacement, an orthopedic surgeon is typically the one who performs the procedure. The field has its roots in correcting skeletal deformities in children, which is actually where the name comes from. Ortho means straight and pedic refers to children. Today, orthopedic surgeons treat patients of all ages, and the specialty has expanded enormously, with subspecialties covering everything from hand surgery to spine surgery to sports injuries. Ophthalmologist. An ophthalmologist is a medical doctor who specializes in the eyes. They can diagnose and treat all eye diseases, prescribe glasses and contact lenses, and perform eye surgery. This sets them apart from optometrists, who can examine eyes and prescribe corrective lenses but are not trained surgeons. Ophthalmology is one of the oldest surgical specialties, with evidence of cataract surgery being performed as far back as ancient India and Egypt. Today, modern ophthalmologists perform incredibly precise procedures, including laser eye surgery and retinal reattachment. Otolaryngologist, more commonly known as an ENT doctor, this specialist handles conditions involving the ear, nose, and throat. The full name comes from the Greek words for ear, nose, and throat, which is why most people simply use the abbreviation. ENT doctors treat hearing loss, sinus infections, tonsillitis, voice disorders, and certain head and neck cancers. It is a specialty that blends both medical and surgical skills, as these doctors regularly perform operations ranging from sinus surgery to the removal of tumors in the head and neck region. Psychiatrist. A psychiatrist is a medical doctor who specializes in mental health. Unlike psychologists, psychiatrists hold medical degrees and are able to prescribe medication. They treat conditions such as depression, anxiety disorders, bipolar disorder, schizophrenia, and addiction. Psychiatry as a formal discipline emerged in the 19th century, though society's understanding of mental illness has changed dramatically since then. Modern psychiatrists often use a combination of medication and therapy, and some subspecialize further, focusing on children, the elderly, or forensic cases involving the legal system. Obstetrician and gynecologist, often referred to as an OB-GYN, this doctor specializes in two closely related areas. The obstetric side covers pregnancy, childbirth, and the postpartum period. The gynecology side covers the broader health of the female reproductive system, including conditions like endometriosis, ovarian cysts, and cervical cancer. Most doctors in this field practice both sides, guiding patients through pregnancy while also providing routine care such as screenings and preventive exams. It is a specialty that blends surgical skill with long-term patient care. Urologist. A urologist focuses on the urinary tract in both men and women, as well as the male reproductive system. They treat kidney stones, urinary incontinence, bladder infections, and prostate conditions, among other things. Urology is a surgical specialty, meaning urologists regularly perform operations, sometimes using minimally invasive robotic techniques. While the specialty is often associated with male health, urologists treat patients of all genders and ages, including children with congenital urinary conditions. Gastroenterologist. This doctor specializes in the digestive system, from the esophagus down to the rectum. They treat conditions like acid reflux, irritable bowel syndrome, Crohn's disease, ulcerative colitis, liver disease, and colon cancer. One of the most common procedures they perform is a colonoscopy, which is used both as a diagnostic tool and as a cancer screening method. The digestive system plays a surprisingly large role in overall health, influencing everything from nutrient absorption to immune function, which makes gastroenterology a particularly broad field. Pulmonologist. A pulmonologist specializes in the lungs and the respiratory system. They treat asthma, chronic obstructive pulmonary disease, pneumonia, tuberculosis, lung cancer, and other breathing-related conditions. The field gained increased public attention during the global response to respiratory pandemics, where pulmonologists played a central role in managing critically ill patients. Many pulmonologists also work in intensive care units, overseeing patients on ventilators and managing complex cases that involve multiple organ systems failing at once. Endocrinologist. This doctor focuses on the endocrine system, which is the network of glands that produce hormones. Hormones regulate an enormous number of bodily functions, including metabolism, growth, reproduction, and mood. Endocrinologists treat diabetes, thyroid disorders, adrenal gland problems, pituitary gland conditions, and hormonal imbalances. Diabetes alone affects hundreds of millions of people worldwide, which makes endocrinology one of the most important specialties in modern medicine, even though many people have never heard the term. Nephrologist. A nephrologist is a specialist in kidney health. The kidneys filter waste from the blood, regulate fluid balance, and produce certain hormones. When they begin to fail, the consequences can be life-threatening. Nephrologists treat chronic kidney disease, kidney infections, electrolyte imbalances, and conditions that require dialysis. They also play a key role in kidney transplant evaluations. The specialty often involves managing patients over many years, since kidney disease tends to be a long-term condition that requires ongoing monitoring and adjustment. Oncologist. An oncologist specializes in the diagnosis and treatment of cancer. There are several types of oncologists. Medical oncologists treat cancer primarily with chemotherapy, immunotherapy, and other drug-based approaches. Surgical oncologists remove tumors through surgery. Radiation oncologists use targeted radiation to destroy cancer cells. Some oncologists subspecialize even further, focusing on a specific type of cancer such as breast cancer, blood cancer, or brain tumors. Oncology is an emotionally demanding field, but it has also seen some of the most significant medical breakthroughs in recent decades.